It's nice to see you guys. A lot of you I've met before, some of you I have not. So when it comes time for you to talk, ask a question, just do a quick introduction of yourself. That would be great. And other people on the call can then find out who's who. I'm Rob Akins. I'm the director for the professional development programs and the professional development core for the Delaware CTR. I'm at Nemours, and I have research that I do in research laboratory, but I'm also for Nemours the executive director for their research career development education programs. So our group came up with this idea of flight school for pilot investigators a number of years ago. And what this is just flight school number one. It's a little bit adaptable to what you guys really want to talk about or have questions about. But what the plan is, I'll go through the RFA that came out and point out the specific things that I want to make sure you're aware of. And we'll take a look at some specific documents and the interface that you need to add things into. The goal is that by the end of this, you'll have an idea of what all the pieces are, and then we can have some conversations about what you and your team, and our group's happy to help. But what should be started early? What are some things that you need to pay attention to now, even though you have quite a kind of a long runway to get the submission done? So things like human subjects forms and stuff like that. So that's the plan. If anybody has any questions right away, let me know. Otherwise, I'll get started here. So any questions? All right, I think this will probably only make sense to people that work with me a lot. I think me sharing my screen thing has been fixed. We were about to find out. Okay, get that out of there. So you all have been invited after a preliminary application to submit for the Clinical and Translational Pilot Awards. Mm-hmm. There's an RFA, or request for proposals, and a full set of instructions that you probably have and you can download as a PDF form. I'm sorry. I am home right now, which you are about to figure out because my dog's going to bark for me to let her outside. Okay, hang on, honey. I'll be right with you. Give me 1 second. All right, you're a pain.
Nice to know I'm not the only one that goes through that. My dogs only have to go out when I'm on the phone.
That's amazing.
Right.
She timed it perfectly. Yeah. I just sat down. She walked by. She gave me a little look, and she's standing over there by the door. So there's a PDF that you can download. Was that Kim? Thanks for saying that.
Yep.
There's a PDF that you can download. I went and made a Word document so that I could mark it up, and I will share this with you. It's hard to put little notes and things, and all I really did was highlight some things that I want to make sure that you guys are aware of. So we're not going to go through every single thing here. It's a pretty, the program has been around for a while, so I think this document is pretty well written. It's a little bit encoded. So if you don't know what these, and I'm going to point out some areas, but if you don't know what some things mean, I want to make sure that you are aware of them. So just so everyone's aware, these are due Monday, May 12th by 5 p.m. They are serious about that at 5 p.m. They're going to close the portal. So do work backwards. It's on a Monday, which gives you the full weekend to work on it. They used to have these deadlines on Fridays, and we pushed a lot to just no one's going to look at it if you submit Friday at 5 before Monday. So give people until Monday to submit. The proposal has to be submitted by the PI, which I know depending on what institution you're at, that gets a little interesting with your sponsored projects office. The PI has to be registered with Excel, and I think by virtue of the fact that you got through the LOI process and got invited, that means you've got to log in, and you have to have a valid ORCID account. Otherwise, if they can't link you to your ORCID account, or if you're not already linked and your profile is incomplete, it will be rejected. You can do what are called multiple PI applications. All the PIs have to be from Excel partner institutions. And there's some, if anyone's thinking about that, toward the end, we can talk about the ups and downs or sort of the pros and cons of working in a multi-PI situation. All right. You cannot concurrently have research funding from other IDEA programs. So if you have an INBRE pilot, you cannot accept a CTR pilot at the same time. And same goes for COBRE or other CTR mechanisms. If you're a PI on a IDEA-funded program grant, on an IDEA-funded pilot grant or any award, you cannot accept the CTR pilot. That rule actually comes from NIH, and it goes way back and has more to do with tracking than anything else. We would love to be able to support people more, but the fact is you cannot hold 2 pilot grants at one time. The budget periods are up to 12 months, what they call regular clinical and translational CNT pilots. There's a version of the pilot grants that are community engagement grants. CNT is still clinical and translational research pilots. Those can run up to 24 months, can be requested for those. The thinking being that it takes longer to engage community and make sure that you have everything in place you need to execute the pilot. There's $80,000 in direct costs. These are typically, although not always, these are typically funded through federal funds, which means the institutions also get indirect costs. And whether or not you are charging salary or anyone on your project is charging salary to the grant, you have to indicate anticipated effort in the budget. So I know from Nemours, although Nemours has changed some of their pre-award systems, this was a problem in the past, where the budgets that Nemours would approve for submission, you weren't allowed to do that. If you weren't claiming effort, they didn't want you on the budget. But in fact, so we had to make some accommodations. I think that's all fixed. If you're a Nemours person, the pre-award, which is Kim Myers-McCombs, who's on here, can help you with that. I don't think that was an issue at other institutions, Delaware State or Christiana. It's certainly the easiest place to submit from is UD, because University of Delaware is the prime holder of the grant. All right, any questions so far?
Could you say that again? What was the problem?
The problem was that they didn't want to indicate effort, but no dollars. So there was this goes back not that long ago, just maybe 2 years. So they didn't want to have a person indicate that they were X% effort and not requesting anything if they were a PI and listed as key personnel. So there's some differences in what's key personnel and what's called an other significant contributor in NIH parlance. So there was just a mismatch between what Nemours wanted and was willing to do and what the requirement was here. So they're expecting, it's an in-kind match. If you're going to spend 10% effort, that's Jason, right, who's talking. If you're going to spend, say, 10% effort on here and not take any of that from the $80,000, that 10% has to come from somewhere that's cost share. And Nemours was just handling those differently than what CTR asked for. It's a good idea to get the budget squared away early, especially if there's anything, if it's all internal to Nemours, there's nothing weird with Jason's at Nemours or internal to your institution, and there's nothing weird with what you're trying to do. Like if you need consultants from another state and it's not an IDEA state, or if you need to have an agreement because you're going to send samples or analyses out somewhere else and you need quotes and things back and forth, the sooner the pre-award team knows about that, the better. And I mean, anything you can really think of, as long as it's kind of kosher and allowable, can be worked out. It's just that for the budget, any agreements with other people that aren't like sort of immediately in your group or at your institution, those things can take time to go back and forth to figure out. Again, if you're at UD, it's a little bit easier because they're the prime. For us at Nemours, just to give you an example of a complication that's come up in the past, we had a person at Nemours submitting for funding, but they wanted to include money to pay someone who's actually at UD. So because Nemours is a sub-award consortium agreement, we're not the prime. We don't get the money directly from the federal government. They couldn't do that on their budget. They had to actually leave the money at UD so that UD could give the money to the person at the University of Delaware, which reduced the amount of money that could come to Nemours. But that took a little, from the time the PI and their co-investors came up with this plan to get all that figured out and worked out, took extra time. So don't wait. Try to get your budgets, outlined and set up as quickly as you can, as soon as you can in the process. And then, there's a lot of upside to doing that. If you have things worked out who's doing what, how many, if it's, you're enrolling patients, how many patients you're enrolling, what the costs are, then polishing the rest of the grant, which is how you get funded, those other documents, the research plan. You can focus on that and not kind of stumble around back and forth with multiple different offices waiting for documents, or somebody didn't sign something they were supposed to, or where are particular pieces of the proposal. So there are cores within Excel. Excel, for those of you who are new to CTR, CTR is the funding mechanism for clinical and translational research. Excel is the program that the CTR grant funds. So the PDC, Professional Development Course, me and Julianne, I think Aaron's on, that's part of Excel, which is funded by CTR. The OGs around often slip between the two, like everybody knows what we're talking about, but think Excel's the program, CTR is the funding. So there are multiple Excel cores that you should consider consulting with, even if you're not doing this proposal, right? There's a BIRD core for biostatistics, epidemiology, and research design. There's a link right there for you to go to if you want to look at the BIRD core. Actually, let me see if I pulled that one up. I started with the CTSA stuff. Hang on. Let me go back just a second. I pulled up, I launched some of these links for you guys so that as we're going through, especially if you have questions, we could talk about it. I skipped over this definition, but NCATS still exists. So if you click on that link, you'll get to this page, and it talks about the translational science spectrum, and it gives you this nice infographic, and there's descriptions of where you are on that for your research, where you are, basic research, preclinical, clinical, implementation, public health, right? So one of the things that Excel wants you to do is be within that huge spectrum from NCATS. The thing that's not there anymore is CDC's definition of community engagement. And I just found this out. I was pulling this up just a couple hours ago to get ready for this. So when you go to that CDC page, you get a page not found. So if you, and I didn't, like quick, show of hands, you can raise your hand kind of silently. How many people are doing community engaged projects? Okay, so at least a few. At least Deb is. So you already, I know you already know the definition, but if there are other folks who don't, you should reach out to the CEO core. I think that, the RFA was put together before recent changes in guidance and sort of what's available information. I know a bunch of places where the PDC used to refer people, those sites are now gone. They're taken down. So, for that particular one, if you need to know or you want to specify, you want to get more concrete details about what the CEO, the Community Engagement and Outreach Core, is expecting, you can contact them directly. So BIRD is the Biostatistics and Epidemiology Research Design Core. That's right. So if you go to the link there, it's a very simple interface. They ask them very basic questions about the project. How many people? What is this for? It really is an exceptionally potent resource for this kind of thing, which you have to, or even if you've got, say, if you have data that you're trying to figure out where you can publish it and you need some analytic help, they can take a look at that. But I will, as a caveat, they are statisticians. So if you have data and you didn't talk to them already, you will get yelled at a little bit about your design, and then they will help you. It's always better to talk to the stats people before you get going. But it's definitely a resource that you should take a look at. There's also this National COVID Cohort Collaborative N3C. There's a link for that. If your investigation is related to, say, long COVID or work that's associated with SARS-CoV-2 infection or COVID-19, then you can use that resource as well. You're right now working with the PD core, so flight school's right here. That's us. The way you get to the PD core, and it's another resource that you are welcome to and actually encouraged to touch base with us, not just as part of, you're supposed to talk to us, right, for this pilot, but just in general. So if you have any questions about resources, how do you do something, you're trying to get connected with a collaborator, anything as a junior investigator, you can email us at mentoring at de-ctr.org. A number, which I think is around 6 people, check that email and they'll connect you with the resources that you need. So the goal of the PD Core is to reduce sort of the amount of stress and time that it takes an individual to go from a research idea to submitting a pilot or their K grant or their R grant. So, you know, if you're thinking about doing those kinds of things, or if you're new to the area or new to the type of research that you're undertaking, let us know. I mentioned the CEO core because of the that lack of that CDC definition anymore, but you can connect with them directly. So Deb, you probably already have talked to them, but you need to talk to them about your community engagement. Right, those are the big cores that are available through Excel. The submission support teams at each of the institutions. So if you're Christiana, that's Brad Bacon. He's the site PI for the CTR grant for the Excel program at Christiana. Same for Delaware State. Sangeeta Gupta is the site PI. Renita Chakrabarty, who I'm not sure if she was just in another meeting, so I'm not sure if she's able to join today. She's the program manager for the CTR and the PDC at Nemours. The PDC sits at Nemours, not at UD. So Renita helps us run that whole operation. And Julianne's, so Renita from like the financial side, Julianne's the coordinator for the activities of the PDC. And then Robin Nizer, if you're submitting from University of Delaware. All right. Any questions? Excellent. All right. So this is always interests me because the full proposal is similar in format to what's called an NIH R03. These are short, usually they're 1 or 2 year grant proposals. But then the next thing they tell you is it's not really similar because it's a one page for your specific aims, which is what an R03 is. But then an R03 has 6 pages for your research plan. You should be very aware, 4 pages, which is what they specify for the significance, innovation, and approach sections, including talking about, and you'll hear about this stuff later, the rigor, prior research, the feasibility, and your community engagement subsections. You only get 4 pages. So if you've written an R03 and you saw that first sentence, you're thinking, oh, this is a quick adaptation. It's not. You have to pull 2 pages out of your R03 submission. And there are step-by-step instructions later on that we'll get to. I'm going to quickly go through, and we can talk in more detail if you want about how these things are adjudicated and scored. But if you're not aware, NIH uses a sort of a Likert scale between 1 and 9. And the thing that matters in terms of your proposal getting funded is what's called the overall impact. So that in all these subsections are on a 1 to 9 scale. So 1 is exceptional. It's essentially a perfect grant, all the way down to 9, which is poor, which is something you should really think about, why you were thinking about doing this. And they use the entire range. With 5, with the the people that run the review panels in CSR, the Center for Scientific Review, they're trying to drive reviewers so that 5 is an average score. So that's the range that you're going to get. There are what are called individual review criteria for the reviewers that has to do with the significance of the work. The investigators, especially and including the primary mentor for you guys, right? Because if you're new to this kind of NIH game, you should have a mentor helping you through the process. And then the big driver, at least back as of a few years ago, the big driver for the overall score is the approach. So when reviewers do their reviews, they will give individual scores for significance, investigators, and approach, and then an overall impact score. And then the panel, amongst the panel, those will be averaged. So it's a 1 to 9 kind of Likert score. So the average is going to be like 2.3, and then you multiply it by 10. So you'll be told your score is a 23, which is a fantastic score. Okay. The community engagement scoring, there is an aspect of community engagement scoring that's included in the regular clinical and translational pilots. So at a minimum, you have to identify the community or an appropriate community with which to engage in the research and a plan to disseminate findings to that community. Sometimes, again, it really depends on what your research is. And I'll try to make sure we have time at the end for specific questions about your specific research. So for us, we work a lot. My research group works with kids that have early onset disease or perinatal onset disease that require surgery. So it's usually the families or the advocacy groups associated with those specific diagnoses. That's the community that we would talk to early on, because we're very sort of in the preclinical to early clinical phases of studies. We're not ready for implementation yet. The community engagement pilots, they must include a detailed plan, and they will be scored on the quality of that plan. So that underscores the need for talking to the community engagement, the CEO, Community Engagement and Outreach Core, about what you're thinking about doing. Okay, questions? So Excel has priorities. That translational spectrum, that's the same link. Oh, no, I think that's actually a different link, curiously enough. So that's then what you would find if you looked at N3C. This is the additional link, right? So one is translational research with this cool visual. The other is this definition, which is a publication from now a number of years ago on that we just used the definition from within this publication. Their main priorities are medically underserved populations, conditions that disproportionately affect Delawareans, and projects led by junior PIs, you all. So that means you're assistant professor. You're new to your institution. You're assistant professor level. You don't have prior NIH funding as a PI, and that's in a research project grant. So if you were, a NNF award, or you had, other NIH funding that you were associated with as a trainee, that doesn't count. That's what in NIH they call that a new investigator, right? NIH new investigator, someone that hasn't had a substantial award of their own. So no prior NIH R01 or equivalent, and no prior Excel funding, except if you were a program we have, the MRDA program. So if you were an MRDA scholar, actually, I'm not sure if any are on MRDA Scholar, and you're writing a grant for Excel. Oh yeah, actually, I didn't know there was one on. Thanks. That's great. And they really are looking for interdisciplinary or projects that span multiple regions of that translational spectrum that we looked at. They guarantee at least 2 community engaged pilots will be recommended for funding, and then they guarantee it and then say if possible. So that everything is sort of couched in the funding allocation comes from NIH. So for those of you who don't know, even though CTR was a 5-year grant, the funding allocation comes on an annual basis. So there is a possibility that for an interval, we don't get as much money as we thought we were going to get because of some vagary in the way the budgets are allocated to NIH from Congress. Right, and then just a reminder of the timeline. Okay, let me see. All right, so that's the kind of the scope of what's in the RFA. I want to go now to the dashboard, and then we'll look at, I started mocking up a grant to submit. So when you go in, you need to have a login for Excel. If you for some reason have an admin profile, it won't look like this. So I do. You would just click here, and it would say switch to public. If you don't have an admin, a reason to have an admin login, you'll just see this. So you can either click on apply for funding opportunities, or just up here go to funding opportunities, and then the pilots will pop up like this. They're made live temporarily. I think they're still working on it a little bit. So I would not recommend starting today. They opened this interface so that I could go in and look at it. Okay. The pages that they talk about that you'll see when you start putting this thing together and looking at the detailed information, they will talk about these PHS 398 pages and give you a link. The link takes you here. And then there's some specific links to face pages and things like that. this is PHS's Public Health Service. This is the standard formatting because, the way that the grants are submitted to CTR is directly from you as a PDF that you upload to the Excel system. We still have to use these old forms. Everything else, like a direct submission to NIH, is done online through their system or through your university. So I think UT uses Cayuse. You interact with a different system, so you don't have to worry about the format of the pages. Okay. It's a little tricky going back and forth. So that's what the dashboard looks like. These are the PHS 398 fillable forms. They give you very specific information about the project title and the abstract and length of the abstract. But let's just go look here. All right, so I skipped one step. That was I went to that funding and I clicked on the pilot to say I wanted to start a new application. And what you'll see when you do that is this set of pieces. These are different pages in the proposal that you need to deal with on the left-hand side. And then there's fillable blanks that are in like the main sandbox. And each step of the way you hit save and continue. At some points, if you don't do the prior step, you can't see the next step. But I think it's always helpful to see the next step. So that's why I filled out test and all these things. So I just answered sort of generic questions. So there's information about the project. There's information about the investigator, right? So you just would click if you're early stage or not and answer the questions that they have for you. Each of the pages has the instructions linked to it. And if you need help, like if there's a big problem, something crashes, your system's not working because you're behind a firewall at the hospital or something like that, you can click on this tab here to get help. So those are easy. We'll get to the harder ones. These are the team members. Aaron, I put you're my mentor here because I figured when you get the email, you'll just ignore it. I don't want to put freak people out because this will generate some information. As you're filling things out, there's some information that's generated. There's questions about demographics, which you can fill out. It is requested that you fill it out, but then there's always this do not wish to provide if you don't care to fill it out. This gets a little bit lengthy, and it goes to questions associated with the DEIA categories and some things that we still want to track that are still being tracked by Excel, at least as of right now. When you see this, this page may be changed dramatically, but they're quick to answer. But just realize you'll be asked those things, and the same things about disadvantaged background, education. This now gets to, so that's all you and sort of the title of the project. This now gets to what's the population you're going to work on. These are, whether these are medically underserved populations or medically underserved areas, the definitions are accessible through the instructions. And it's actually in the RFA, there's another link where you can find the definitions. So you just fill in as is appropriate for what you're working on. That translational science, right, spectrum, that infographic, you would just pick which area or areas that you're working in. And that this is about the specific project you're submitting. And again, hopefully there is a classification. You can click to get more information, to go back to that link and look at it. Right. The conditions, right? It's interesting the ways it's set up, but these are, you're asked, are you working on something that disproportionately affects Delaware? And these are based on data that are available to Excel and through the state, are places where Delaware is in pretty bad shape. These are health focus areas that have been identified by the state and by the institutions in the state. These are Excel health focus areas. These are risk factors that disproportionately, I mean, it says what it is, right? So you're asked, are you working in these areas? And when you say yes, that very list pops up again and you check which ones, right? So I think they're, if you click no, that just disappears, right? So most of you, actually most of us are working in some area that's represented on that list. And I think about it to make sure that you check all the ones that are relevant. It helps with tracking, and it also helps with the assignment of reviewers. If the pilot team knows what you're working on. This has to do with the community engagement status of the project. Budget we talked about, it's critical. I don't know anyone that's ever requested less than the maximum unless they made a mistake early on. So typically that's going to be the 80,000 direct funds that you can request. Once you set up your ORCID, so mine's been set up for a while. If you don't have it set up, you'll be guided on how to do that here. I hope that everyone has an ORCID profile linked already. It's not particularly onerous to do. Right, this is the one I wanted to get to make sure that everyone saw it. So I'm going to say yes to both these questions. So answering these questions generates forms underneath. Say yes. Wait, I'm going to say no because I don't have an NCT. That's the clinical trials number. And then yes for animals. So you need to provide all of these individual documents as PDFs. And I don't know if there's a way to get I guess I can do a screenshot or something afterwards to get this list to you. The first time I went through to help somebody, some of these things, I was surprised some of these things were separate documents. And in some ways, knowing what you're going to be expected and what's required for you to upload is a good thing. Forewarned is forearmed. So a budget justification, which UD provides in the guidance document in the RFA, their format. I think every institution has their preferred format for their pre-award folks, but you do have to justify, and your pre-award team will have to make sure that everything you're asking for and the way you're asking for it is allowable. A detailed budget, a phase page, which is in that PHS, this thing here. Right, there's a face page here, so you have to use that particular face page. I think that, let's see. Oh no, that's human subjects. I want to do your survey. Letter of support from your mentor, your bio sketch, which has to be specifically formatted. There's some language in the RFA about what's called My Science CV. We'll talk about at the end if we have a few minutes left at the end. That's an interface that NIH has been working on for a decade, that they're going to start requiring investigators to use to generate their bio sketches. Your reference is cited, gets uploaded as a separate document. So just to be aware, and some of these, like the human subjects forms, although it's listed as one thing, they take a long time to fill out. And we'll talk about that in a second. These are your other sources of funding that you've gotten in the past. This is for tracking in evals. They just want to know, did you talk to your OSP people, which I think you should do tomorrow as soon as possible, that you're working on this thing. Bird Core, whether you need statistical analysis, us and the community engagement core. And then there's just a summary page at the end. So the red things are things that I didn't do in this, so I'm not going to be allowed to submit it. So that's what the interface looks like. It's actually gotten pretty good. I think the past few times, and Julianne or Aaron can correct me if I'm wrong, there have been fewer and fewer kind of glitches. There were some weird glitches, especially if you were at not UD. So if you were at Nemours and working on your laptop behind the Nemours firewall, there were some things that were problematic. Same thing at Christiana, and I think Delft State had some additional issues. All right, any questions about kind of the scope? All right, so let's go back. The three things I recommend you work on, one I already said right away. One is the budget with your office. And it might be easy. They might say, hey, this is simple, just keep in touch with us. It might be a very easy interaction, but you want to make sure that they're on board soon. And in particular, if there's anything, as I said, involving other institutions, investigators, companies, getting quotes, that kind of thing. Second thing is the bio sketch, which I hope everyone here has. If you have not written an NIH bio sketch, we can set up a separate, that's a whole meeting in and of itself on how to do that and how to write an effective personal statement and what you should and should not include and what the format looks like. So get your bio sketches done, and that's plural because it's you and anybody who's considered key personnel, right? Other people on your grant. So you have collaborating investigators or mentor. You have to get all those bio sketches organized together, formatted correctly, and referring in the personal statement, you refer to the project. So they all have to be referring to the actual project. So that's something good to get started. Oh, yeah. There's a little drop down in Teams to make some of this hard. All right, so the last thing that I'll recommend working on right away is the human subjects forms. So if you've done NIH or federal human subjects studies before, that's great. You know what I'm talking about and why you need to start those things early. If you've done clinical trials, sponsored clinical trials, you have some of this information, but not all of it. This is the reason I pulled this up is this is the link. So if you click the link in the RFA, it goes to this grants.gov page, which lists a whole bunch of places where you need to, of things you can download, right? So what you want is the human subjects. I already lost it because I moved. Let's see. You have the human subjects in clinical trials information and then the form. So what you'll get when you click on it is this. Don't freak out at it. Even if you have Adobe Reader 8 or higher, for some reason, everyone seems to get this error message. So what you want to do is just find the PDF, right click on it and download it. And once you download it, then you can open it in your, you can open it in your, whatever Acrobat you have. So that's the instructions. So that what you'll get, and if you look at this, this does not look hard to fill out. This is the page that you'll get when you download it. Trickily by the government, they put this additional link in here in the middle. That's the thing that's actually complicated to fill out. So you have to click that also, and then that gets this thing called a study record, which is required. You have to fill this out, and it's a fillable PDF that you can link files to. So things like the study title, which if you're doing a clinical study, that should match your IRB. If it doesn't match your IRB, you're going to have a problem down the road because these proposals get vetted through a study section, then by the Excel team, and then by NIH. And NIH won't sign off on something unless everything matches. So you want to use a study title that matches your IRB. And preferably, your IRB should be the same as the title of your proposal, your pilot grant proposal. And then there's some simple questions that you can answer here. So we'll just say it's not exempt from federal regulations. It involves participants, but we're going to make this an observational trial. And if this looks alien to you and you're going to do a human subjects, especially if it's interventional, just email that mentoring at de-ctr.org and ask for help, and we can find someone to go through more specifically. There's a recording also that I forget who did that. There was a recording that one of the Excel leads did on filling out these forms. But when you look, let me spread this out a little bit. Right, so when you scroll down, you start filling this thing out. You'll find you have to put in a condition, you have to include eligibility criteria, ages, you have to add attachments. So that one box, when you look at the Excel upload for human subject forms, includes multiple different forms. There's 1, 2, 3, 4, 5, 6, 7 forms that go into that one slot. They all link together as a single PDF at the end of the day. But this is not something to learn halfway through trying to prepare your submission. So you have to talk about including individuals across the lifespan. That's a requirement, including women and minorities. So for us, for the first one, we're a children's hospital, they're children's diseases. I have to justify why I'm not enrolling, octogenarians in my studies. So you just have to explain it. They're not saying that you have to include people that don't make sense or participants that don't make sense. They are saying that you have to explain it. Your recruitment and retention plan, this is just whether or not you've started yet. These will all be not yet recruiting, a timeline, when you plan on enrolling your first subject. And then this thing called an inclusion enrollment report. Where's the here? Okay. I couldn't remember if I had to fill things out. Oh shoot! But to get this to generate, so you have to list within this document your planned enrollment based on these categories. And I get that these categories don't necessarily make scientific sense for what you're working on, and they may not make sense with current guidance that HHS has. This is still, as far as I know, as of today, this is still a required document. So if you're doing this, you're doing it for the first time, there's you can calculate, you're going to enroll 500 people, 500 participants. You can calculate based on your knowledge of the demographics of the study population, or I typically use the demographics in the state of Delaware. You can calculate, well, how many of each should be included here so that you represent the full population. Again, I'm bringing this up so that you're aware of it now and you're not stuck with like an hour to try to figure out how to fill this out, because this is supposed to reflect sort of a sampling of the population that's representative of all these classes. All right, so human subjects is the third thing that you guys should really consider working on soon.
Rob, all of these attachments, these other ones that you mentioned, what are they?
The PDFs. Sorry, I didn't mention that. Yeah, so these are short.
No, what I mean, what's the content? Are they forms, or is it just like where you write a paragraph to just you just write something? These ones that are on the page here. Inclusion of individuals across the lifespan, etc.
It's a paragraph, and we have examples of each of these, right? There are some aspects of the human subjects that have required subheadings. I'm going to skip it because we don't have a lot of time. Same thing on the IACUC. So if you have animal usage, there are specific questions that you need to address on those. So most of these are paragraphs that you write, just explaining. Some of them can be quite long, right? So and I'm happy to share with you. We just submitted a grant. It's an observational study for cerebral palsy, but I'm happy to share those documents. And by I am happy, I mean Julianne can help me get them to you to show you the way I do it. For you again at Nemours, the first person you're going to want to talk to is someone from Kim's group about how to pull these things together. The old folks like us, I have the way I write these. My study team, for example, which is another page somewhere, I use a table. Other people don't. So I think there's just ways that you've gotten to do it. But most of what you have to write is narrative. It's written as paragraphs. But I think between our examples that we had with PDC and then your pre-award folks, whoever's helping you put this together, and your mentors, you should just get a template and follow their template. So you don't have to worry about whether or not you're including all of the necessary pieces. Other questions? All right. So and this is the last thing, and then we'll go on. We'll do questions, and then I can talk about the science CV. These are the forms that you can download. This is what they look like. And again, I'm showing you because the cover page is not that simple to fill out. It has a lot of information, including your ERA username, your exemption number, who's the administrative official to be notified, which you may or may not know. The sooner you touch base with your pre-award, your research office, or your sponsored project folks who can help you fill these things out. So that's the face page 1. There's a project summary that you'll have to fill out. And then I believe they want all of this. You can work with Megan Wenner's group, like the DUNS number, I think they actually want filled out on these forms. And then these are the additional project sites. This is what your budget will look like eventually. Most people go through some version of Excel spreadsheets before it populates into here. Example of budget justification. Your biosketch again, something if you don't have one already that's been vetted, let us know and we can help you fill this out and give you some examples. The two big things are make sure the form you're using is current and make sure that you don't go over 5 pages for all of the sections. They do post, this is a sample. Again, I pulled all of these from, where'd it go? Here. Nope. This one. So there's no voodoo or anything. You can do the same thing I did, which is just click on the MS Word version of the form and you'll get exactly the same thing. So there's examples that they have. One example, a couple of examples they have for a biosketch. Right. Any questions before I talk about this briefly? Back to you guys.
Hi, Rob. I had a couple. Drew Fancher at UD. So I may have missed the first quick couple ones. The fillable forms, the PHS 398. We need to put specific aims, everything on the product. We can't just put PDFs that don't have the designation. Correct? Am I understanding that correctly?
That is what it says in the directions, that they want you to use the continuation pages, but the continuation pages are just 1/2 inch margins around the outside with the page numbers. So some of them, there's not really a form there, but they do want you to use the forms. You'll see when you click on it and you look at it, you'll see if it's stylized, if there's a table on it, they want you to fill it out there. So it facilitates the reviewers and the admins finding what they need to find because everything looks the same. It's kind of a hassle if you got a whole bunch of budgets and they're all formatted differently. You just want to know one thing. Yeah.
So it doesn't matter if it has in the footnotes or the title part, the PI name and stuff like that, which is what those. Okay.
Not for the continuation pages, correct.
And then do you have, I might have missed this as well. Did you give an estimate for when the portal will be open?
I thought it would be open now. I think I don't know that. Julianne, do you know when they'll have the portal open?
Sorry, my mic. I believe it's open now.
Okay.
But they opened it for me.
It could stay open and we could just delete this test proposal that you're submitting now, if that makes sense.
I got it. So if not already, then very soon.
Okay.
It'll be open.
And then one more from my perspective, sorry.
Okay.
The community engagement. So I'm very much, my project is very much on the preclinical basic science translational part of the spectrum. So my community engagement section is probably a bit more truncated than some others. So I'm wondering how the scoring is weighted in that section for somebody like mine versus someone who has a more pronounced community engagement component.
They're considered separately, and this is historical knowledge. So I don't know what the panel is going to do this time, just to be clear, right? I can't tell you how your investment is going to go this time around. But in the past, for the applications like yours that are preclinical or basic early translational, that part was you just had to do it and explain what the community, and not a community practice, this is like a community affected by your work and how you will reach out to them, sort of a dissemination plan. So it can be very short to do that. I think at least when I was sitting on the panels for the regular clinical and translational research pilots, those were talked about, but they didn't go into the score. Okay. And I get a comment back saying, this is a better group to talk to, or try to expand this. For the ones that are community engaged specifically, it is a big part of their score.
Okay, thank you.
Hi, it's Erin, and I can just add in that, Drew, you can also take advantage of the community engaged consult if you write a portion of it and just want them to give it kind of their stamp of approval before you hit submit. That's a great way to utilize that core.
Awesome. I'm meeting with Dr. Chen soon. So
that's great. That's a great idea. Other questions? All right, let me just show you. This is coming in May, so I know your pilot's the main thing on your minds right now. We're encouraging everyone to think into the future about other grants that they would want to submit. Renita, did you have something you want to add before I do this?
Just had a comment. What we have seen in the years prior, that on the deadline day, we have seen glitches.
please be prepared and try to submit on time. And if you have any glitches, reach to Karen Hoff so that she can connect. The website team sits at Nemours, so it's easier if it's easier for Nemours as investigators, they can reach out to me. But typically, I've seen folks reach out to Karen Hoff, and she connects with the website team in case of glitches. So.
And you can also submit a ticket through the website. So if you're in the CTR website and you're experiencing issues, if you hover over your initials on the top right, you can click on MIS team request, and that submits a ticket directly to the team. I would encourage anyone who utilizes any of this, take screenshots, because sometimes it's easier for them to see what the actual issue is. So that is another option for you as well.
Renita's clapping for you. And it's a weird thing because the group's very good and they try to anticipate and they beta test and they do everything. But sometimes it's because the person was using a VPN, right? So the whatever the server didn't like all of a sudden what the VPN was doing, and that's what the glitch was. Other times it had to do with the specific way things could be downloaded or couldn't be downloaded because you were behind some firewall by what building you were in. But they are very quick turnaround. Any other questions? Actually, I'll very quickly show you this My Science CV thing because it is coming. It is nothing to be afraid of. It is something you have to deal with. My fundamental message, I guess. So this is this is my login, right? So you can see the first time I did a profile was in 2015, and that's because I'd been working kind of in this space of trying to help people get their grants. That's when NIH started saying we were going to have to do this. They finally said we were really, really, really going to have to do this May. It's pretty straightforward. They have some good help, right? So you can get descriptions of what they're trying to accomplish. And then this is great. This is a publication that came out. You can see it was created in 2013. Again, they've been thinking about this for a while, but this goes through, click here, add this, do that. That's pretty straightforward stuff. What ultimately they want is that your publications will be accessible through PubMed Central or linked to your ORCID ID, and your ORCID profile can be used to identify who you are. So what it does, what My Science CV does is just links me. This is just a test I pulled in. So I didn't try to do anything with this. It just pulls in my ORCID. It gives some of my training information, the personal statement that I have on ORCID, and then it just lists what it pulled from ORCID. And then everything else you have to edit in the section, but then you can save it. So I didn't actually try to do anything with this one. If you once you get one set up, it's pretty straightforward to use, and you can select which articles, right, from your list. This is through the National Library of Medicine, NLM, which references you want to use for the specific biosketch that you're putting together. Ultimately, I think the plan still is that the biosketches become automated, that you don't have to do much of anything. The information that reviewers or anyone would want is available through the portal, and you would just indicate which were the most relevant articles for them to look at. But there's still some work that you have to do. But it's not, I suggest going on when you have some time and taking a look at it. As I said, we're always encouraging people to think about submissions, more submissions later on in the year. So if you submit anything after, I think it's May 25th of 2025, you have to use this to generate your biosketch. At the end of the day, your biosketch is going to look pretty much exactly the same as your biosketch would if you didn't use this. It's just that they're trying to get everyone to use the system. So that's all my spiels for you guys for Flight School 1. Does anybody have questions specific to their project or questions in general about submitting their CTR pilot grant?
It's Erin again. I'm just going to take a minute to plug Flight School 2 and Flight School 3. So Flight School 2 is an opportunity for you to sit down and have someone review your biosketch. In our experience, biosketches are heavily reviewed during the panel. So if it's not the correct format or not hitting the exact questions, it's a great opportunity for you to do that. Flight School 3 is a peer review, and this is also a very unique opportunity. You would review someone in the group's specific aims, and someone else in the group would review your specific aims. So you get experience at being a reviewer and also getting your aims reviewed. And the reason this is done is because a lot of times on a scientific panel, the third person may not be a subject matter expert on your science, and this is particularly true in doing these grants because we don't have a ton of top level science for every area in Delaware. So it really makes your specific aims readable and understandable to a wide review panel, which is always a benefit. So there are limited spots. So if you are considering this, please understand the time commitment and just let Julianne know or mentoring at DE-CTR.org, and we can work with you guys to get those set up.
It might seem a little weird that you're, depending on how competitive you are, that you're helping someone else that you're competing with. But the fact is you are not competing with this cohort. You guys, we're trying to help you compete with people that have done lots of these grants. So the fact that you can get peer review information and help each other out helps you compete with them. There are very senior investigators that will be submitting pilot investigations, and they're supposed to cut you guys a break just between us because we're here. That doesn't always happen, especially if they've got a stellar biosketch and you look like you didn't read all the rules. So getting those reviews, those peer reviews, is extremely helpful. Just gets, everybody on this call should be able to compete on that level. And the competition is in the approach, right? That's where you get the score. That's what when you're working with your mentor, the most important page is the aims page, because that's what everybody looks at to get oriented. And usually at the end of the aims page, if someone wants you to get funded, they will give you a good review, but their score is going to be based on the approach. So you really need to work on that with your mentor. Those other two pieces that we help you with, that's so you can compete with the other folks in the pool. Jason, you have a question?
Yeah, I have a question. If nobody else has a question, it's not an urgent question.
You're up. Nobody else has their hand out. So
I guess so. All right. Yeah. Well, this is about the detail of the submission, and maybe it's not really for you, but maybe it's for Renita or Kim because it's no more specific. But in the instructions I got from, I got a timeline. I think that was from Kim's office, and it had some deadlines, and it said, or my understanding is that even though the deadline is officially the 12th, I actually have to hand everything over to the grants office like a week before. So I'm wondering, are they going to give it back to me so that then I can load it to the website, or do I have to put it on the website the week before and then they just take care of everything? Because yeah, I'm just not sure about the details there about the submission.
Jason, this is Kim.
Uh-huh.
That timeline came from us in grants development, and Connor and I will work with you on all of those details. I'm not sure if you've had your first meeting with Connor yet.
Yeah.
Okay. So each time you meet with him, you'll learn more about the process and how we will help you with each of these documents and your timelines. So any
Right.
specific questions like that, you would take directly to Connor.
Okay.
Wonderful. Thank you very much, everyone. If anything comes up, just use that. So if there is a parallel mentoring at email box at Nemours. I don't want to confuse the Nemours folks. You can use either one, DE-CTR.org. But for everyone, you can use mentoring at DE-CTR.org to get back in touch with the broader group here. So if you can't remember, or if I said something that turns out is wrong, which hopefully that's not true, but you never know. Or if you just want more information, or if something's not making sense when you go and look at it, don't spend too long. We have Aaron's 5-minute rule. If it takes you longer than 5 minutes to figure out what you need to do, email that email address. Kind of the worst thing that happens is while you're waiting, and we usually get back to you pretty quickly, while you're waiting, you figure it out. But usually what happens is we'll connect you with someone who knows how to do it and helps you through the rest of the process. So thanks, everybody. I appreciate it. Hopefully we'll see you all for Flight School 2.
Rob, is it okay? This is Renita. Can I add one more comment, one or two?
Sure.
Okay, I just wanted to highlight the fact about the detailed budgets. Please look at that section because you will need to submit, depending on what budget, what kind of proposal you are doing, you will, if it's a regular, you have to do 2 form page 4s. If it's a community engagement, 3. Just keep that in mind, and that's more for your pre-award office. And the last one I wanted to highlight is thank you, Rob, for the demonstration of the signed CV. That was
You're
very
welcome.
helpful, even for me. It was very helpful. But whoever is invited to do a just-in-time submission, once everything is reviewed, they have to submit another biosketch for their entire teams, which needs to be in the signed CV format.
Oh, really? That part I didn't know. Okay.
It is on page 9 of the RFA, where it says, please be prepared to generate a new biosketch using signed CV for all team members for the JIT collection.
Gotcha. Okay. Thank you very much. That's helpful. All right. Good luck, everybody. Let us know if you need any more help.